I'm Dr. Patricia Fulmer out of Huntsville, Alabama. I started my career in a secondary tertiary medical referral center, and then last year decided to get back in private practice. So I'm in a group practice now with a few friends and living the dream in primary care.
So my name is Laura Goldberg. I graduated from the New England College of Optometry in 2016. Since then, I did a residency in Wilmington, Delaware at the VA there. And now I'm up in Syracuse working for private practice.
Hi, I'm Dr. Sabrina Mayo. I graduated from NECO also in 2016, and I purchased a 30-year solo optometry private practice in Exeter, New Hampshire, and I'm currently there, going strong, and it's working out pretty well.
All right. So we're talking about what we wish we knew before we graduated. So we could go on for hours, quite honestly. That's not a joke. But I guess we'll take it from the top. I mean, when you graduate, you think you know everything, but you really don't. Probably don't know much at all, particularly in regards to business and running practices and what it's like in the real world of optometry. So what are just some, first thing, hard lessons you learned right after graduation?
You don't walk out the door with a job. You've got to put a little legwork in. Networking, of course, when you're in school is important. Those connections that maybe you don't think are important become important when you graduate, and you need to find somewhere, especially for you moving. I think both of you ladies obviously left the area where NECO was and found jobs elsewhere. So, how'd you go about that?
Well, for me, it was a little bit more challenging because I grew up in Jersey my whole life, and so I kind of created my connections working for optometrists in college, and life doesn't always go as planned. Sometimes you take different paths. So I did a VA residency in Delaware, really because I wanted the option of working at a VA later in life, and a lot of people don't know that it's kind of ideal to work for a VA as a resident. If you ever want to work for VA, they really kind of hone in on those residents. Near the end of my residency, I knew I was going to move up to Syracuse, so what I did really was just start cold calling and emailing people. Some of really good resources to find jobs, which I didn't realize, was you can actually contact reps in the area because they're always going in and out of the optometry practices. They kind of know what's going on in the private practice world. So that was one way that I kind of got some leads. As well as there's recruiters, which I didn't know much about recruiters until I graduated, and they're people that practices hire to kind of find potential employees, optometrists. They kind of help set you up with the job, kind of go through the contract with you, and then eventually, like on LinkedIn, you'll start to see all these recruiters pop up, and they'll start finding you and asking you if you're interested in certain jobs in that area. So I did all of that, and finally, after cold emailing quite a few optometrists, I found the right fit. They kind of took me on out of the blue, which was fantastic of them, took a chance on me, and I've been happy. I've been there for about 8 months. So that's kind of how my story is, how I ended up where I am right now.
You own your own practice, right? So
Yeah,
yours was a little different.
My story's unique. So what I did was I did some research in my area. I knew that I was going back to my hometown, and I found a private practitioner that was a little older. It appeared that he would want to retire in the next 4 or 5 years, so I approached him. I gave him my ideas that I wanted to graduate and buy his practice, and so that's what happened. I developed a very strong business plan. I got financialing and lenders, and so about 2 months after graduating, I owned a practice. So my recommendation to other students who will be graduating is find out where you want to practice early on in the game, like even your first year. Find out, who might be hiring and what type of modality that you want to practice in, and set some goals. Maybe even reach out and observing different doctors and see where you might possibly want to be in the future.
You might be going to school somewhere, and a lot of times after you graduate, you move off to a different place. Maybe go back home, and you're going to be practicing there. But the problem is a lot of the connections you make and a lot of the networking you do is in the state you're going to school in. So when you're getting ready to go back home, it's kind of like, well, you don't know anyone. You got to start your job search from scratch. And you know, back when I graduated, there wasn't covalent careers. It didn't exist yet. So it was very challenging to connect with a lot of employers. But if I could give you guys a piece of advice, it'd probably be, even if an opportunity is just for 1 day a week, that could lead to a full-time job, you know, after a month or so. That's kind of what happened to me. I had an opportunity to work just Fridays and every other Saturday, and at first I wasn't even bothered because I wanted a full-time position, but I did that for maybe a month or two, and then they said, well, you know what, we could use you full-time now. So that's kind of how my job kind of situation unfolded.
Yeah, I think you make a really good point about the full-time, part-time expectation when we get out of school. Most students think that they're going to be able to graduate, walk out, have a 5-day-a-week job or a 4-day-a-week job.
Working 9 to 5, right?
Yeah, and
full
that
benefits.
It's going to be no Saturdays and all that sort of stuff. And you know, that's just not reality in the way that our profession is now. And a lot of times, a lot of the people that I graduated with did the exact same path that you did. They couldn't find a full-time job in the city they wanted to be in. They knew that where they wanted to go, but they couldn't find that right fit. There wasn't a practice that was ready to bring on somebody full-time. So they pieced together a few different days, or you know, maybe 2 days here and 3 days here, or two and one. I mean, I had some friends that were doing 5 days a week at different places, but it eventually turned into something and they settled in.
Yeah, definitely. And once you start doing that, you start getting these paychecks, right? They're paying you, and you're saying, man, this is a nice check. And you start collecting them all, and little do you know, then you start entering the battle of, well, why are they paying me like this? You know, what's this 1099 thing, right? Why am I filling this out? What does that mean, right? I don't remember learning anything about 1099 in school or W-2 in school, right? Taxes, right? So that's probably something else that I wish I learned about when I was in school was, what is the difference? Because a lot of us will be paid as 1099 independent contractors, and that is a whole nother ballgame, right? And you guys experienced that when you first graduated. Were you paid as a W-2, a 1099?
So I was paid as a W-2. I think
You were lucky.
I know. I think I had one experience when I worked as like a blogger for Necco, and they put me in a 1099, and when I got my taxes done, that was a surprise. But no, I'd be more curious to learn about the differences because I don't have much experience with 1099. I just know from hearsay.
Yeah, I think almost none of us have any experience with it, right? Unless you just happen to have a CPA in the family, or you worked before you went to school, maybe you understood it. But most of us that graduate have no clue about taxes. We don't know whether, we know we hear these studies or we hear the news talking about, how much we're going to pay in taxes, but we don't really know what that means, right? You get a contract that says that you're going to make $100,000 a year, and you get that first check and you do the math and you're like, that's not that's not even close to $100,000 a year. But it's something that I think if you have no experience in, which again, that's most of us, incredibly important to find those connections in your town. Find a CPA, find somebody that is going to be able to explain it to you and know how to really direct you and advise you so that you can make the best of the situation, because it's unfortunately not going to go away. Taxes are there to stay. So when you don't know about it, don't feel like you have to understand everything, but find somebody that does.
I agree. Definitely get an accountant right out of school, and a good one.
Yeah, just to kind of break it down, maybe some of the viewers don't really know what 1099 W-2 is, but I haven't really dealt with this for a while, but the main difference is that in one situation you're being paid as an employee, where your taxes are kind of withheld from your paycheck, so you get paid and the taxes are taken out. There's all kinds of different taxes. Your employer's paying a percentage of an employment tax for you. You're paying the other percentage, whereas at 1099 you get your whole wage and there's no taxes taken out. So it's your job to pay taxes on that money on a quarterly basis. You should be sending in quarterly payments, and you're responsible for paying the entire self-employment tax, the breakdown of it. That's why, as you said, very important to get involved with a good accountant after you graduate, because the last thing you want to do is file your tax at the end of the year and find out you got to send in $40,000. It's very difficult to come up with $40,000. I don't know about you guys, but I don't have $40,000 just lying around.
Nor do I want to give it to anybody all at once.
Yeah, exactly. So I guess that's another good question, right? So you got a team, right? Accountants, very important in terms of how you're going to be earning money, making money. But what else financially? I mean, there's a lot of other stuff going on, right? Student loans, that's another big one. So everyone's situation will be different there, right? What are the best repayment strategies? What's interest really like once you're graduating? I'm sure all of us probably graduated with student loans. I mean, I don't know, maybe.
Yeah.
I didn't have a rich
Yeah.
uncle, so I was,
Yeah.
you know, graduated with student loans, probably like everybody else. But what's that? You know, when you get that first statement after you graduate, you're looking at it and you're like, holy smokes, that is just for interest, right?
Yeah, so initially, your repayment plan is going to be based on a 10-year repayment because that's what they would prefer. They're going to get the biggest payment out of you in that way. On the pro side, you're done in 10 years. If you can afford that, if you can set aside enough money out of your paycheck, and that's the way you want to do it, go for it. Those are the cases a lot of times that people will start to maybe, if they can, put a little extra into there so that their principal starts to come down and they're not just paying interest every single month. However, if that number is just too high, or if you have other financial strategies that you're looking toward, I think it's really important to understand that there are financial-based repayment plans so that they each year will look at what you're making and adjust accordingly, and that payment is significantly lower. It's usually about half of what that 10-year payment would be, and it allows you to have a little more money toward living expenses, buying a house, whatever it is that your financial goals are. And I think a lot of us, you know, we've never made that kind of money before in our lives, right? We've been students, we've had student loans, we may be living on $10,000 a year of play money or living money, and now we're getting a real paycheck, and that's a whole different ballgame. So just like we said, get a CPA. I think a financial advisor, very, very important. How a lot of people ask me, how do you know if it's a good one? I say you can't necessarily till you really talk to them. But the best way to do it is to find somebody in that town that you respect and that you know is being successful in the way that you would like to be successful, and find out who they work with, because they probably didn't get there with a poor team of people. So if it's somebody that can come with a good recommendation and get you started in the right direction.
I definitely recommend consolidating your loans right out of school. Usually that can bring the interest down a little on some of the higher interest loans that you take out. Yeah, get a financial planner. I did the 20-year plan, and I pay more on it just so I know that I'm not required to, but if I have extra money, then I do. And usually you make enough that you can pay for it. Don't stress about it, because you're going to be paying it for a while, probably. So.
And I think don't be intimidated by the fact that you're going to hear some people say you have to pay them off immediately. And then you're going to hear some people say it's not a negative debt, meaning it's not hurting your credit, it's not doing anything to keep you from getting a car or a house or whatever. So, you know, don't worry about that one as much. Pay what you have to, but maybe set up the rest of your finances. I don't think there's a right or wrong in that. I think it's very much personal preference, and that's where those advisors come in. You set those long-term goals and then say, okay, how do I get here based on what I've got in my portfolio?
Think of it like it's an investment in your education, so you're just investing in yourself constantly. So don't be stressed about it.
Anything to add?
I guess one thing I can add is that some people coming out of school end up working for community health centers because they offer loan forgiveness programs. So that might be something to look into if you're trying to kind of keep the costs down a little bit.
Yeah, I mean, this stuff's confusing, you know, but that's part of the reason why, you know, we created New Grad Optometry and Covalent Careers, because we're offering resources on this stuff now. We're trying to, you know, make this easier, but, you know, we could talk about finances all day. But another interesting tidbit about finances is kind of, you know, when you're out there practicing, right? Here's one thing I didn't know. So when you're in school, you're kind of going through clinic, and you don't really learn much about billing and coding. At least we didn't. You know, we had from what I can remember, we had a couple courses, and I think we had like lunchtime courses where we kind of learned a little bit, just the basics, not to get audited. But one thing I didn't know is that, especially as a practice owner, you're kind of well aware of this stuff now, is that, you know, you have these exams, and, you know, you're thinking that, okay, our exam fee is $140, and every time you see a patient, okay, you're getting $140. Not the case, especially not in the world of insurance, right? So you might be doing an exam, and you might get paid $40 for that exam. You might do an exam, you might get paid $38, you know, it depends. So I'm sure as a practice owner, that was a lesson you learned real fast, right?
Yes, so you might charge X for an exam, but you actually get paid why. So when you sign up with a insurance company, you need to accept their assignment schedule. And so make sure that when you're getting credentialed that you look at that and you can understand that. A lot of private insurance companies will pay you more, and then vision service plans will pay you less. And so it's just something that you need to know about or be aware about. And you need to know how to code, because that's how you get paid. So you really need to know, is this a new patient or a previous patient? Did you do a refraction? Make sure that you are coding appropriately and you know that what tests you can do within the same day and still be able to get paid.
Yeah, and I think you mentioned looking at reimbursement schedules. I think another way as you first get started, especially if you enter practice and maybe you're an associate or you're not an owning doctor at that point, you don't necessarily see the behind the scenes. You just get your paycheck and you bill, and if something's wrong, hopefully the billing and coding department or one person or office manager catches that, and if they're doing good, then they're going to bring that to your attention so that you don't continue to make that mistake. But I think it's really important, especially as a new grad, if you can, sit down with that person and find out, okay, where could I be billing better? Where can, when we get these EOBs back or explanation of benefits, what does it say? Why are we getting paid what we're getting paid? Because if you can start to understand those, you're really going to understand what you can bill and how you can maximize your chair time to make sure that you're billing accordingly and really getting justified payment for what you're doing in the exam room. I see a lot of doctors not billing for everything that they do. They maybe have multiple procedures that they could bill, and they can bill those together, but they either don't understand it or they got busy and missed a code, and that pays off in the long run.
Or you might be billing them all at once when you first get out of school, not realizing
Don't
that
get
that's
paid for
not the
anything.
way it works. Or you can't bill, certain procedures all in the same day, and you think you can. So, when you're in school, you do a glaucoma workup, and you're dragging over gonioscopy, you're dragging over fundus photography, you're dragging over visual fields, dragging over OCT, and you're looking at that saying, man, I'm going to get paid all kinds of money for this, right? Not how it works,
No,
right?
sometimes you need to do things on separate days if you're going to get paid. Or you pick which one that you want to bill for, and then you just don't get paid for the other one.
Or another, if you really do need to do it that day, there's, some practitioners will just do it kind of as a baseline, and they understand that they're not going to get paid for that, and they do it more for their, interpretation and clinical diagnostic value for the patient. Some will explain to the patient, I need to do this test. Your insurance is not going to cover that. We're getting an ABN, and, this part of it will be out of pocket. If you explain it well, and I think if you have a justified reason to do that, most patients will understand that, and if they may need to do a payment plan, or maybe they defer that to a different day, but you should expect to be paid for your services. What we do, I think optometry, unfortunately, a lot of times gives away things a little bit too easily and doesn't value what we do as quickly. So don't be afraid to have that financial conversation with the patient if they truly need the treatment you're trying to give them.
But you certainly shouldn't be doing tests just for reimbursements. You want to be making sure that every test you do has a purpose. It's important in what you're managing.
Yeah, and if it really is just for I want to make myself feel better about what I think it is, then that's probably not the best time to bill it.
Right, exactly. Yeah. So, what else?
Gosh, you're right. There's so much.
Yeah.
I think as students, sometimes we get out and you get so engulfed in your world and establishing not only your professional career, but your life wherever you're at, and you forget to stay connected.
Yeah, staying connected.
Yeah.
Getting burnt out. That's a big one. I
Yeah.
feel like when you first get out of school, you're eager to work. And I know I was working like 6 days a week, long days, and I found myself quickly not liking what I was doing. Does that happen to any of you guys?
Yeah, I still work 6 days a week. Every other week, I fill in corporate on the weekends, which is actually a great option for people because you still get paid holidays, part-time. You can kind of negotiate your hours a little bit better. But so the way I stay connected is that I negotiated my fees for the NYSOA and my local society through my contract because it was really important to me. And both of my bosses are also members. Currently, I'm a young advocate through the NYSOA, which is a pilot program where they take a few young ODs from each region of New York and try to get them to kind of connect with other young ODs, reach out, hold events, get them interested because a lot of young ODs kind of fall off the track and it's hard to find them again. And we need them to kind of keep on the legacy, fill these positions in the future when the older generation starts to retire, and kind of keep fighting for a scope of practice. And it's just a nice way to build a community in a place where you might be new. I was new and I felt a little lost in the beginning. I didn't know anyone, so that was a really nice way to connect.
I might be an outlier because I love my job and I work all the time, and I'm okay with it.
Well, you're a practice owner,
Yeah.
so
I have the ability to take a day off here and there if I need to.
Right. But even then, I mean, how do you stay connected? You've already got a practice that's thriving and you enjoy it and you love it, but, how do you make sure that you don't get just completely surrounded in your world and not connected to the rest of optometry?
So I
profession.
so I have a solo practice, so I really am not around ODs very often. So I make a point every month to meet with some OD friends in my community. We talk, we have dinner. I always go to Vision Expo East, I go to Academy, so that's how I stay connected with the community. And
Yeah, I
I'm a
think
part of the
that's
NHOA, the
great.
AOA,
Yeah, I think when you graduate, we kind of walk out of school thinking that we know, we're ready. We know everything. We can go practice and hit the ground running. And I had a professor or a attending in residency that would, every time I'd have a review, his last comment every time was keep reading, and I was kind of like, okay, cool. But what he was getting at is that you have to make sure you never stop learning, right? And I'm the same. I go to Academy pretty much every year, go to Vision Expo, East and West, and that way I stay connected and I know what's coming down the pipeline, and I'm not just focused into my world and keep doing the same things over and over, because if I do, then 10 years down the road, I'm going to be the antiquated doctor that's still treating with old materials when everybody else is doing something really cool.
I feel like when you're in school, you're in clinic a lot, you see all these crazy things, right? All this ocular disease, but I would probably say that most of us, after graduating, probably aren't going to be in those kind of situations, right? You're just going to be doing routine care. So was that any surprise to you when you first got out of school? I mean, it depends on where you started working, but I know when I first got out of school, I didn't really see much ocular disease. It was just kind of routine exams. So it was, a lot of refractions, a lot of the same things over and over and over again. So that was pretty shocking for me because I was expecting something totally different.
Well, my situation was a little bit different in that I did actually end up in a medical referral center to begin with for the first 4 years of my career. So
Did you feel prepared for that?
internally, I think there's a question, but I did a residency. It was ocular disease. That obviously gave me a lot more confidence, but there was a little bit of nerves walking into it, knowing that, regardless of the residency, I was still straight out of school, had never truly practiced a day in my life that was just me practicing. And I was about to be, not only in a referral center, but
It's
the one
strange,
referred
right?
to.
When
Yeah.
no one comes in and checks your exam after you're done, isn't it?
It is, and it's, going into a world where ODs were referring to me and expecting me to know the answer as a new graduate was a whole thing to get used to. But I think for me, the biggest learning curve was realizing what needed to be in that exam, because in school, and even in residency to an extent, you're kind of expected to do everything, right? And in the real world, that's not necessarily true. You tailor your exam to whatever it is that patient is there for. So if it's a full exam, then there's certain things that go with that. If it's a medical exam, certain things that go with that. I think that takes a minute to learn.
Yeah, that's a real fast lesson you'll learn, right? You're not going to be doing every single test on every single patient. If you are, you'll probably lose your job because you can't see one patient an hour. It's not going to work, right?
Just also kind of knowing when to refer when you're in private practice, because you just can't manage every disease that walks in your door. So like Sabrina said, setting up good connections. I mean, when I worked at the VA, we were expected to kind of manage all the way up until moderate to severe glaucoma, whereas in private practice, probably aren't comfortable with that, and that's the time when you want to refer. So kind of just knowing what's valuable to your practice and when they would benefit from kind of going somewhere else.
And I think understanding that everyone's going to have a different comfort level with that, right? That it's okay that I may refer at one stage and you may refer at another. Doesn't mean that we're doing it incorrectly either way, just as long as we're serving that patient for your comfort level. And if you build that network, like you mentioned, and you've got your retinal surgeon or you've got your cataract surgeon, you can refer over and then see how they manage that patient. And if it was the same thing that you would have done, then maybe the next time you don't refer quite as early, or maybe you just pick up the phone and say, hey, I've got this in my chair. Should I send it, or do you think I can, manage this on my own right now? And a lot of them are very willing to have those conversations with you. I think knowing that it's not that barrier, it doesn't have to be that barrier that sometimes we think there is in school.
And don't be afraid to use each other. I mean, we had group messages when I first graduated, sending pictures to each other. I've got this patient in my chair, what do I do? You probably don't have all the answers in the beginning, and that's okay. You might need to make a decision, and then later on you might think about it and say, I wonder if I made the right decision. Maybe I should call that patient back and say, you know what, let's get you back here a little sooner than 3 months. Let's maybe get you back here in 1 month,
Yeah, being in a setting where I kind of was expected to know, when they sent it in to me. It was, but it was really awesome to see that deep down I did actually know most of what I needed to know. And if I didn't, I still had other colleagues, or I had other, ophthalmologists or books online. There were a lot of resources that I could find for that. Or, like you said, I just shortened my follow-up schedule. If I thought it was something that maybe down the road I see them back in a week or two, there in the beginning, maybe I saw them at a day or two. And that let me, if I needed to change things, I could gain confidence for myself. A couple of times I came in on the weekends, more so that I could sleep at night. Then, the patient was doing fine and everything was going fine. But if I did need to change, it would have been okay.
Yeah, it's good to reach out to other colleagues, and there's nothing wrong with close follow-up.
So how do you handle, as a young OD, when you're in the exam room, and this happens to me, not as much anymore, unfortunately, and, someone told me this, they said, when you first get out of school, you'll probably be examining patients, and they'll all say, how old are you? You old enough to do this? How old are you, 20? I get that sometimes, so I'm sure you probably have all experienced that. And I was told also, enjoy that while it lasts, because eventually you're going to stop hearing it, and you're going to start wondering yourself, oh man, right? I'm getting older. So that's kind of happened to me, where I used to hear it all the time. And, I would joke around. So, a patient would say, oh, how old are you? You 17? You 18? You driving yet? And I'd be like, oh, no, I just turned 21, So, I used to joke around with them a little bit. But, I would do a good job. And once they got confident in me, that kind of young factor would disappear, right? So I'm sure you probably all experienced this. So a lot of young ODs will probably go through the same thing. So how do you kind of handle that?
You just laugh it off, joke with them. I mean, it is what it is. And, I bought the practice from a 65-year-old gentleman. So then they see me, and they're like, who are you? Are you the tech? And then, you just laugh it off. What else are you going to do?
I think also kind of dressing the part. I was kind of told, like, the patient should kind of know who is the doctor and who is the staff. So you kind of want to dress the part or the job that you want, or the job that you have. That's one way to make yourself appear older. You can put up, like I put up my credentials up there, and sometimes in the waiting room they'll take a look, and then they'll ask me about it, and then they'll be like, oh, that's impressive. But a lot of times you just kind of have to prove yourself. It works out.
Yeah, I think not letting it bother you is the first step, and not letting them see that it bothers you, because then they the confidence level is maybe a little bit lowered. But especially, and no offense to Antonio, but I think females get that especially more than, for whatever reason, than a lot of the male doctors do, and some do. But when we go into the room, we expect a certain level of respect, just like we're going to give that respect to the patient. And I think sometimes people take that question as a disrespectful one, when a lot of times the patient doesn't mean it that way. They're either, sometimes, especially in the older population, it's almost a compliment. They think they're kind of complimenting you because you look so young. And a lot of times when I come back, I'll be like, well, thank you. I hope that sticks with me, because that'll, I'll really like it when I'm 40 or 50 or whatever. But just letting it be lighthearted. And like you said, whether you're wearing, we wear scrubs in our practice a lot. When we wear scrubs, I wear my white coat, because that differentiates. If I'm not in scrubs, then maybe I don't wear it. It just depends on, if I'm cold or not, really. But I think you're right. Setting yourself apart from the staff, even if, there were times that I would just get like a monogram on my scrub, so that I didn't have to wear my coat if it was a place where I was going to be doing more of like community care and things like that. But setting yourself apart from your staff is important.
Yeah, and I also think that sometimes you kind of have this battle even with the staff that's already there, because you come in, you're the young OD, and the staff has been there longer than you, and they're kind of like, well, you're new here, number one, you're younger than me, number two, and they might not treat you with the same kind of respect, so to speak, as they would the senior doctor, right? So that's something that a lot of young ODs will experience as they start to get out into the workforce, right? So it's almost like there's two different strategies to that. You can either A, be friendly, right? Try to be their friend, or B, try to be their boss. So have you had any experience with that? Have you kind of, what has your strategy been?
So in the practice that I went into out of residency, I was a center director. So I was then immediately thrown into hiring, firing, managing staff, which we knew nothing about in school. That doesn't even get addressed really, of how to manage a staff. And I had employees that were anywhere from my age to about 65. And really learning my staff, learning that the 65-year-old didn't need to be approached in the same way as the 30-year-old about different things, learning that maybe she learned in a different way, and so I needed to present the materials in a different way. But I think the absolute biggest thing is that you've got to go in with respect for the staff, because they have been there, they know the practice, they've got a lot to teach you if you'll listen. You can still be that boss without being a dictator, without being, disrespectful to
Definitely.
treat them better than you would ever want to be treated yourself, and they're going to automatically be on your side.
Maybe not try to, impose your personality on the practice, especially right away as a new, graduate or new employee, right?
And you mentioned, you can be friends with them. I think it's important if you're going to be any kind of management role remember you can be friendly and you can be respectful and form relationships, but be very careful not to truly become friends with your staff in the way of, sometimes outside of the office, you'll hear a lot of people say, be friendly, but don't be friends. And the reason that happens is because you start to get errors of favoritism, or sometimes people think that they can get away with things because they're your friend, and then they get upset when you discipline them. It's a very fine line, and you can fill out each practice. Everyone's a little bit different, and it depends on the size of your practice. I'm sure you have a different relationship with your staff than if it was a 5-doctor practice with,
I'm sure that
with
was a
40
big
people.
change for you, right? Going in, all of a sudden you're the boss.
Yeah, so there was actually only one employee there. She was 70 years old, and
How old?
70.
Oh, okay.
Yeah.
That's pretty tough.
Yeah. So you need to be respectful. You need to understand she was there. She still is there. So she was there for 20 years, and she knows all of the patients. And you have to be respectful for that, but also instill that you are the employer. You make the calls. You make the executive decisions. And so we had to integrate EMRs and technology. And, she's doing great. She's embraced it. Sometimes we have our quarrels, but that's part of business. I'm the youngest in the practice. I employ everyone is 20 years older than me. So that can be a challenge, but you just need to be confident in your decisions and make sure you have like a layout and a template of how you're going to deal with different situations when staff or employees come to you and they want answers because you are the employer. So, I mean, I don't know.
Yeah, and I think
situation for
like you said,
but
y'all have, there was a learning curve, and she had to kind of get up to speed with some things. And I think you have to understand that you are going to be making changes and be very intentional in those changes and know why you're doing those.
Yes.
Because if they can understand kind of the why behind it, even though, some people go in and be like, well, because I said so. And that's not necessarily the best approach when you're trying to win over a staff that's worked for somebody else for a while. If you can really make them understand the why, a lot of times they get behind it better. But sometimes they just can't keep up, or they aren't a good fit for the new practice, and that's okay. And you have to be able, I think, to understand that and be fine with maybe, saying this isn't the best fit anymore. Maybe we need to part ways.
If they're not working, you really need to get rid of them soon. Don't let it last, because I did have an employee where I was trying to make it work. I didn't want to do anything about it, and it just really brought down the environment in the practice. So,
Well, I'm in a different situation. I'm kind of in like the young OD. I'm not the boss, so I'm kind of more on the friendly side with my staff. I feel a little awkward kind of disciplining them, kind of getting their respect. Although most times they are very respectful of me, in my opinion. That kind of shows the job that my boss did. But, there's times where there's confrontation, and I'm still learning kind of how to deal with that, where my role is. I don't want to upset them because they think that I'm kind of stepping in a role that I'm not supposed to. But that'll come up at some point, especially if I'm there longer. start to gain a larger role in the practice, not just being like an employee. So, I'm kind of learning as I go.
Yeah, so we'll just wrap it up here. Just final thoughts, right? So I guess we should probably end with final pieces of advice for all the new ODs, new grad ODs. If I was going to offer something up, I would probably say your first job is, might not be your ideal job, but that's okay because you need to start getting experience somewhere. So even if it's not the perfect opportunity right away, it's not a bad thing to work a little bit, work in different environments, different settings, see what you like, see what you don't like, because you might end up quickly realizing that, private practice might not be for you, or maybe corporate optometry is not for you. You might like one thing, or you might like a mix of everything. Don't be afraid to experience different things before you finally decide what you really want to do, because when you're first graduating, you don't really know what you want to do.
Yeah, I would definitely agree with that and add to it that, if you aren't 100% sure, if you don't know that you have a practice waiting for you or that you absolutely want to be in a certain town doing a certain thing, consider a residency. If anything, it's going to add to what you know, it's going to add to your confidence level, and it's going to open doors. And whether or not you take those doors is completely up to you, but you know that you haven't closed yourself off to opportunity. So if you don't know, I think that's a great way to spend your first year, get your feet wet a little bit without, completely diving in head first. And I think that, like you said, don't be afraid to make the changes. When you get in those positions and you realize, this isn't what I thought it was going to be, or maybe I really do enjoy doing something in practice that I thought I didn't enjoy, and that's what my passion is now. Follow that. Don't be scared to make the changes because, especially in your early career, that's the time to really figure yourself out. You're always learning in optometry, but you're always learning yourself as well. So, continue to learn, continue to listen to that voice inside you that says, I enjoy this, and figure out how to make a career out of those things that make you happy so that you're not going to work every day, that it's just your life and you enjoy it. And one kind of off-topic thing I want to add is we didn't really talk about, personal life stuff, and, we did touch on finances, and you mentioned buying a house and things like that, but if you are looking to buy a house, especially as a new graduate, I was fortunate enough to have a mom that's a realtor, so she knew a lot of the behind the scenes, but I think there's loans and things out there that a lot of students don't know anything about, young professional loans or doctorate loans, where you can get 100% financing, you can get no PMI, you can get a lot of different things with a lot of different banks. So if that's something you want to do, don't hold yourself back. Go talk to them, because a lot of times there's opportunities out there that really can make that possible quicker than you think it would be.
Yeah, kind of going off of that and being open to change. I did a residency in ocular disease, but getting out in practice, I kind of realized that I liked working with kids, and, I'm involved in myopia control now. I actually started a myopia control clinic in the practice that I'm at, and so it's never too late to kind of change gears. I know a lot of doctors who've worked at VAs for many years in the beginning, and now they're doing vision therapy, so you can always kind of branch out and learn different fields. Don't be afraid to keep learning, keep your resume kind of building, do residency, do a fellowship. It seems kind of overwhelming at first, but it feels really good to kind of just keep building upon your career, keeping up to date on things. If you don't have a Roth IRA right now, you should get one right away. A lot of people do not know about investing. I'm very lucky that my parents are pretty adamant about me investing very early on in my life, and I know it's not an option for everyone, but if you can just put aside, like $100 a month and just build it, and even like have stocks and build that, it will pay off in the future. Yeah.
So my final thoughts are: make sure that you find out what you're passionate about, and then set goals in all aspects of your life, optometry, financial, and family as well, and make a 5-year plan for yourself. I definitely think that Roth IRAs, and it's never too early to think about retirement. So definitely start that process earlier rather than later.
I'm hoping I can retire soon, so we'll see about that. But thanks for listening. If you have any questions, we're here for you.